Good. Good.
Dull. Sharp. Warm.
Also eucalyptus. Yes. How is this?
Sharp.
Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your examination today. I have here your file, but it's been a long time since we saw you in the clinic. Can you please verify your date of birth for us?
Yeah. 12/01/02.
Okay. And are you taking any new medicine?
I am taking spirulactone for my acne.
How long ago were you prescribed this?
About 3 months ago.
Okay. And are you experiencing any side effects?
No.
Okay. And when was your last checkup?
A year and a half ago.
Okay. Are you experiencing any pain?
I am, yes, in my lower back and the bottom of my skull.
How would you rate the pain on a scale of 0 to 10, 10 being the worst?
I think a 4 in my lower back and a 6.
And is it constant or it comes and goes?
It comes and goes.
Okay. And are you experiencing any sharp pain? How would you describe it?
When I lean over to the right, I can feel a sharp pain in my rib cage. Yeah.
For how long has that been going on?
A couple weeks.
Okay. Are you experiencing any blurry vision?
Yes, at night.
Okay. Are you hearing any sounds that are not there, maybe?
Sometimes I hear a ringing noise, but it's not often enough where I feel like I should be concerned.
Okay. Have you noticed any changes in your smell or taste?
No.
Any metallic taste?
No, but maybe a dry mouth.
Okay. Any issues or problems with breathing? Have you noticed sometimes that you're breathing faster than normal or slower than normal?
No.
Okay. And are you experiencing any skipped beats, any palpitations?
I don't think so.
Okay. Any trouble with your stomach, any abdominal pain?
A little bit, yeah.
And is it more centered, right or left?
I feel like centered. I normally just take a Tums though when it happens.
Okay. Is it sharp or is it more dull?
Maybe a mix of the two.
Have you noticed the pain increases or decreases after food or before food?
Definitely before food.
Okay. Anything else that I didn't cover that you would like me to check for you?
I don't think so.
Okay. I'm gonna start with your blood pressure first, and then we'll do a regular checkup to make sure that we are not missing anything. I'm going to put gloves on. Are you experiencing any numbness or tingling sensation in your fingers or toes? Okay. All right, I'm gonna have you take this off for me so that I can take your blood pressure. I'm gonna use your left arm. This is going to feel pretty tight. I'm gonna have you breathe normal, just relax. blood pressure, it is a little bit low. We would like the systolic to be somewhere between 110 and 125. Yours is 99. So that could explain some of the blurry vision that you're experiencing at night. Are you experiencing blurry vision right now? No. Okay. All right, I'm gonna have you look right here for me. I'm gonna shine a bright light in your eyes. Okay. I'm going to divide your field of vision. Keep on looking straight at my nose. Good. So your pupils are on and reactive to light. I'm gonna press down on your eyelid. We're checking for any discoloration. Okay. Go ahead and look up for me. Okay, normal eyeball color. Go ahead and look right here for me. Okay. Okay, no irregular eye movements. Okay, go ahead and give me a big ah. No redness, no discoloration. Okay, can you go ahead and push with your tongue inside your cheek? Good, and the other side. Okay, I'm gonna try to lift up your head. Don't let me do that. I'm gonna try to turn your head to the left. Don't let me do that. It is a little bit weaker on the side. Is that the strongest that you can do?
I think so.
Okay, what about now? Okay, a little bit stronger, that's good. Go ahead and shrug your shoulders and relax. Okay. I'm going to check your reflexes. Go ahead and relax your jaw for me, just a tad. Good. Good. Moving to the shoulders. Go ahead and relax your shoulders. Okay. Now you relax your elbow, your whole arm. Okay. Okay, we're definitely going to check your magnesium levels to see if there's any deficiency, and also your vitamin D. Okay. Okay. So the right side is definitely a little bit more responsive. Good. Okay. I'm going to listen to your heart. You can just breathe normal for this part. This is going to feel a little bit cold. I can hear S1 and S2. No S3, no S4. Go ahead and take a deep breath in through your nose. Out through your mouth. And again, breathe in. And breathe out. One more time. Slowly breathe in. And exhale. Okay, I'm going to take a look at your back. I'm going to have you turn towards the wall. I'm going to put your hair up so that we can take a look at the nape and cervical spine. Okay, so you're gonna feel my fingers starting at the base of your skull. We're palpating cervical vertebrae. We have here atlas. I'm not feeling any swelling. The tissue is soft. And it seems to be normal spaces in between atlas and axis. Looking at the curvature of the spine, some deviations might be normal. So we want to make sure that there are no signs of scoliosis or lordosis. Sometimes that type of pressure could really trigger some pain. Okay. I'm going to check your reflexes of the spinal nerves. Okay, neurologically seems to be normal, behaving within normal limits. I'm going to here listen for any microscopic movements. We're looking for any cerebrospinal fluid that might be leaking from the tubes. Slight microscopic movement can be heard at T2 and T3. Go ahead and take a deep breath in through your nose, out through your mouth, and again breathe in, breathe out. One more time, breathe in. We're checking the base of the lungs to make sure there is no respiratory infection. Okay, I'm going to check the skin turgor to make sure that the elasticity is according to where we want the hydration and nutrition levels to be. Hydration level does look within normal limits. We're checking the skin for any raised bumps We're looking for inflammation. Taking measurements of the spine from C1 to sacrum. We're looking for an imbalance. And this would indicate inflammation that we definitely need to assess. So there is about a 5-degree difference from right to left when we're looking at the thoracic area. And that could definitely bring an imbalance to cervical and lumbar and explain the pain, discomfort that you're experiencing. I'm going to do sensory tests to see if there is any nerve damage or nerve constriction. You're going to feel a vibration. Let me know if you do feel it or you don't.
I feel it.
Okay, now go ahead and tell me when you don't feel it anymore.
I don't feel it. I don't feel it. I don't feel it. I don't feel it.
Okay. We're looking at the thoracic area, so we're going to run a few more tests here. I'm going to touch you with 2 textures. One is going to feel sharp. This is what sharp will feel like. And the other one is going to be dull. This is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. 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 dull, dull, sharp, sharp, dull, sharp, sharp.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Do you feel this equally?
No.
Okay, I'm gonna use a different texture to check. Okay, go ahead and tell me you feel this on the left or right.
Right. Left. Right. Left.
Does this feel cold or warm?
Warm. Warm.
And now?
Warm. Warm. Cold. 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 Warm. 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 Warm.
Do you feel this warm all the way to the center?
Yes. Cold. Warm.
Do you feel this warm all the way to the center?
Yes.
Okay. I'm gonna have you lay down. I'm going to take a look at your head and neck as you lay down. It's going to help me understand a little bit more of the anatomy. I'm gonna start by palpating your TMJ, and then we're going to take a look at the lymph system. I'm not noticing any bulging, but on the right side it does seem to be more enlarged. Are you experiencing any tension on the left or right?
Slightly on the right.
Okay, looking at the masseter, it does seem to be a tad more developed. Okay, going to palpate behind the ears, looking for any signs of mastoiditis, swelling or tenderness. Palpating the neck region, starting with the cervical lymph nodes right above the collarbone. palpating submental lymph nodes right under the chin. Okay, can definitely palpate the salivary glands, which are normal size. I'm looking for any. We're looking for the preauricular lymph nodes right in front of the ears and postauricular lymph nodes, which are under and kind of behind the ears. Not noticing any signs of lymphadenopathy. Checking trachea for a midline position. Checking the thyroid gland for any enlargement or nodules. Palpating sinuses now. Right in between your eyebrows, we have the first set. Looking for any tenderness. Okay, tissue is soft, which is within normal limits. No edema noted. Moving down right under your eyes on each side of the nostril. Okay. I'm going to cover one nostril. Go ahead and breathe in, breathe out. And we're going to check patency over the right side as well. Breathe in, breathe out. Okay, so a little bit of obstruction on the left side. I'm going to have you take a deep breath in through your nose and out through your mouth. And let me know if you're able to identify the smell. You go with this? Okay. I'm gonna try one more. Go ahead and breathe in and breathe out. What does that smell like? Also eucalyptus. Okay. I'm going to check your taste. We have here a few flavors. This one is the control one. Can I have you open, taste, and close? Close your mouth. Okay, open. What does that taste like?
Nothing.
Okay, perfect. Okay, go ahead and open, and close, and open. Are you able to identify the taste?
It doesn't taste like anything.
Go ahead and open and close and open. And are you able to identify any specific taste for that?
No.
Okay, so definitely we need to investigate this a little bit further. I'm going to check your facial nerves. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right. Right. Left.
Do you feel this equally on both sides?
Yes. Yes. Yes.
Do you feel this cold or warm temperature?
Cold. Warm. Warm. Cold. Warm. Cold. Warm.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Okay. And does this feel the same as this?
No.
Okay. Go ahead and tell me when you don't feel this vibration anymore, when it stops.
I don't feel it. I don't feel it. It stopped. It stopped. It stopped. It stopped.
Okay.
It stopped. It stopped. It stopped.
Which position here is louder for you? This or this?
2.
Position 1 or position 2?
2.
Go ahead and tell me which ear you hear a sound closer to you. Left or right?
Right.
Okay.
Left.
Okay. Tell me with which ear you hear this sound.
Right. Left. Right. Left. Both. Both. Both.
Okay. noticing a little bit of discoloration on the right side, more towards the crown. Have you noticed any itching or burning sensations lately?
Some itching, yes.
Okay. Could be from some constriction of blood vessels. Definitely want to see how extensive this is. Okay, definitely noticing a little bit of the excoriation on the right side. I'm going to go ahead and take a sample of that. First, we're going to apply a buffer to activate the cells so that we can remove them safely. Now that we activated the cells, we're just gonna have to do a manual excoriation so that we remove the cells that we want to test. Okay, we're going to send this to the lab. I'm going to take a look at your abdomen now. So first I'm just doing a visual inspection of the 4 quadrants. I'm looking for any obvious asymmetry. Okay. First, I'm going to listen to the right upper quadrant. This is going to feel a little bit cold. listening to the aortic valve. Moving to the left quadrant. Left lower quadrant. Slightly immobility on the left side. Going to do a very light palpation first, and then we're going to go into a deeper one to check for any involvement of enlargement. Okay, let me know if you feel any kind of tenderness. Checking both kidneys as well. Okay. Slight tension on the right midsection.
There's some tenderness up there.
Okay. I'm just gonna go in a little bit gentler. Okay, I'm going to check for any sensitivity on this side. Go ahead and tell me if you feel this dry or wet.
Dry. Dry. Wet. Wet. Dry. Dry. Wet. 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 Dry.
Go ahead and tell me if you feel this all the way to the midsection.
Yes. Yes.
Okay.
Yes. Yes.
Okay, I'm gonna take a few measurements of the left side. You want to compare and to see if there's any asymmetry. Even a slight asymmetry could trigger inflammation at the cellular level. About 3-degree difference on both sides, so that really is a good indication of a little bit of asymmetry. I'm going to percuss. We're looking for any abnormal sounds. Okay, very normal percussion sounds. We're going to run some more tests to see exactly why you're experiencing that tenderness on the left side. It does seem to be a little bit swollen, I would say. So we're going to run a CT of the abdomen, and we're going to know for sure if there is a need for other investigation tests. Okay, so just very gentle pressure here. We're looking for any edema, changes in temperature, something that would maybe indicate a circulatory obstruction. Okay. I am noticing a little bit of bruising. Do you remember hitting your left lower shin? Okay. It does look a little bit old, so it must have been about a week or a week and a half. Okay. I'm going to check your pedal pulses. Slightly diminished, and I'm noticing that the lower part of the feet is a little bit colder. We're going to check capillary refill. Slightly delayed, I would say about 3 seconds. Okay, I'm gonna check your reflexes. I'm gonna have you relax your leg. I'm going to lift it up from the knee. Okay, how is this? Good, okay. Okay, perfect. Okay, go ahead and leg. Now let's go on and bend and put it on top of the other one. Okay, slightly diminished on the right side. Same thing. Okay, left side looks good. I'm going to check your Babinski reflex. Go ahead and relax. Okay, relax. Okay. Okay, go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Sharp.
Does this feel cold or warm?
Warm. Cold. Warm. Warm. Cold. Warm.
Do you feel this cold all the way up to the knee?
Yes.
And now?
Yes.
Do you feel this cold all the way down?
Yes.
And now?
Yes.
Okay. Do you feel this equal to this?
Yes.
And does this feel equal to this?
Yes.
And does this feel equal to this?
No.
Does this feel the same as this?
No.
Okay. Just going to listen and look for any venous stagnation. We want to make sure that there is good blood flow to the extremities. Go ahead and wiggle your toes. Okay, I'm going to move your right toe either towards you or towards me. Go ahead and tell me what you feel.
Me. You. You. Me.
Okay, I'm looking for any dryness. The skin looks intact. Checking pedal pulses one more time. I'd say slightly diminished on both sides. Okay, I'm going to check the strength and mobility here. Go ahead and push with your pads. Okay, pull. Okay, I'm going to try to bring your heels up. Don't let me do that. Okay, gonna try to open. Don't let me do that. Just slightly slightly weaker on the right side. I'm gonna try to close. Don't let me do that. Okay. I'm gonna have you stand up. I'm gonna talk about the results. Okay, one final test. I want to see your arms right there in front of you. So we're gonna look for any desynchronization between right and left. I'm gonna try to push them down. Don't let me do that. Good. Okay. Go ahead and squeeze my fingers. All right. I'm gonna try to open them now. Don't let me do that. I'm gonna try to close. Don't let me do that. Okay. Go ahead and relax. Go ahead and cover one eye. Okay. And I'm gonna have you try to touch my finger with your right index. Okay. I'm gonna do that a little bit faster now. Okay. Okay, let's go ahead and switch. Okay. Slight desynchronization on the left side. So we're going to run a few more tests before we conclude to a diagnosis. I'm going to do a CT scan of the abdomen and then an MRI of the upper neck and head, okay?
Okay.
The nurse outside is going to schedule you for these two tests, and then once we have the results, I'm going to get back to you with a clear prognosis and to figure out what we can do to help with your pain.
Okay, thank you.
You're welcome. Thank you for coming in.
Thank you.
See you soon. I'm going to start with scalp rub. I'll have you relax all your scalp muscles. Okay, let's go ahead and put your hair up so that we can work on your shoulders. working on upper muscles that support your shoulders and your spine. Using the side of my palm to apply gentle pressure on the paraspinal muscles. This helps the muscle to relax. Relax your arm. to work on the trapezius muscles and the sternocleidomastoid that's going up to the occipitus. This also helps to relax and lower the heart rate. Sometimes during stress, our heart rates are elevated. Just a very gentle massage on the carotid artery. Relax your head. I know. That was all for today.
Thank you.
You're welcome. How are you feeling?
I feel fantastic. I felt so good.
Well, it was very nice that I was able to do this head massage. And I hope I'll see you soon.
Thank you.
Hi, Amanda.
Hi.
My name is Dr. Matt. I'm going to do your exam.
Nice to meet you.
Nice to meet you too. Thanks for coming in. Since I don't have medical records for you, can you please state your full name and your date of birth? We're just going to create a new file for you.
It's Amanda Jackson and July 2nd, 2000.
Okay. Do you have any allergies to medications?
No.
Okay. And when was your last physical?
About a year ago.
Any concerns that you would like me to address today?
No, just like a yearly routine.
Okay. Are you taking any medications on a daily basis? When was your last gynecology exam?
Last year.
Okay. What about dental?
Like a few months ago.
Okay. Alright. Do you wear contacts?
Yes.
Okay. When was your last eye exam?
Maybe 6 months ago.
And how often does your prescription change?
It doesn't really change that much anymore.
Okay. Alright. Have you noticed any bumps or itchiness or eczema on your body?
No.
Okay. And are you experiencing any blurry vision, any peripheral vision loss, double vision? Okay. Have you noticed any changes in your voice?
No.
Any flu-like symptoms?
No.
Okay. Any changes in your muscle tone or balance? Okay. Are you experiencing any pain right now?
No, not really.
Okay. And have you had any surgeries in your lifetime?
Yes, I have.
Okay. What surgeries?
I had surgery on my elbow.
How long ago was that?
Like 15 years ago.
Okay. And which elbow is it?
Left.
Was that from an accident?
Yes.
Okay. Any other injuries?
No.
Okay. How many hours per night do you sleep?
Like 7 to 8.
And is that enough for you to feel rested in the morning?
Yeah.
And what kind of diet do you have?
I'm a vegetarian.
Okay. For how long have you been
10
vegetarian?
years.
Are you taking any supplements?
No.
Okay, we're definitely going to check your B levels. It's very common for vegetarians and vegan people, those who follow a plant-based diet, to have a deficiency in the vitamin B. So we just want to make sure that everything looks good. Do you drink coffee?
No.
And what about alcohol?
No.
And do you smoke?
No.
Perfect. Let's see. Family history. Do you have any family history of heart problems?
No.
All right. I believe I have everything. Let's go ahead and start with your vital signs. I'm going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
No.
All right. 96.4 Fahrenheit. And I'm going to check your blood pressure. Is the left arm okay?
Mm.
All right. Perfect. I'm going to have you relax and uncross your legs. Okay. This will go on your arm. Blood pressure is 110/70, which is very normal. I'm going to go ahead and slide this down. Let's go ahead and check your pulses. So I'm going to put 2 fingers on your wrist.
Mm-hmm.
Okay, now I'm just going to go ahead and compare. Good. Strong and symmetric. Temperature was 96.7 Fahrenheit. Respiratory rate is about 16 per minute. Blood pressure 110/70. Heart rate was 75. Alright, perfect. I'm going to start with a vision check. Go ahead and look straight here at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation. Good. I'm just going to go ahead and lower your eyelid and take a look and see if there is any yellowish discoloration. Okay. I'm going to have you close your eyes and I'm going to try to open them. Don't let me do that. Good. Now go ahead and lift your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, perfect. Now go ahead and look right here. All right. Now look here. Okay. Go ahead and give me a big Not seeing any redness. Tongue looks pink and symmetric. Go ahead and give me a big smile. Good. So that's symmetric. And now frown for me. All right. And puff your cheeks. Keep them puffed for me. Don't let me unpuff them. All right. Relax. A little bit of asymmetry there on the right side. We're going to check your muscles there too in just a second. Let's go ahead and check your nose now. Okay, I'm going to have you look up. So we're looking for obstruction. Okay, that looks good. That looks normal. Let's go ahead and check your ears as well. I'm going to have you look towards your right side and relax.
tympanic membrane is pro-gray. There is no signs of infection. A little bit of obstruction here. We could definitely go ahead and remove some of that earwax. I'm going to take some measurements. So first we're going to start with head circumference. Good. Going to check the shoulder length. Okay. And just go ahead and extend your arm like this. I'm going to measure your arms. And the other side. Okay. And now I'll check the circumference of your arm. So we're looking to see if there is any asymmetry in between them. Okay, I'm going to check your waist as well. Go ahead and place your arms a little bit to the side. Okay, good. And relax. Okay. Perfect. I'm going to check your reflexes now. So we're going to start with the jaw. I'm going to have you relax your jaw a little bit. So kind of like this. Perfect. Okay, good. Okay. Go ahead and relax your elbow. This is the elbow that you had the accident on. Okay. Good. Relax. Okay, relax your arm. Good. Perfect. Okay, wonderful. So I'm gonna have you turn around and I'll take a look at your back now, okay? I'm going to go ahead and put gloves on. And first I'm going to take a look at your back. Now put your hair up in a bun just so that we can take a look at the spine. Sorry. I'm going to start by palpating, looking at the cervical spine. Noticing a little bit of lordosis and the thoracic area. Let me know if you experience any kind of pain as I'm pressing down. And I'm not noticing any other signs of abnormal curvatures. No scoliosis. Doing some measurements on the upper spine. It's going to feel a little bit cold. Slight swelling as I'm moving up the cervical spine. And it diminishes as we're going towards the thoracic area. Slight asymmetry between left scapula and right. So I'm going to keep an eye on that and see if it changes in the next 6 months. I'm going to touch you on the right and left side of your spine. Go ahead and tell me if you feel this on the right or left.
Right. Right. Left. Left. Right. Left. Both. 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 Right. Left. The middle. The middle. The middle.
Okay, that was very good. Next, I'm going to draw some shapes and letters that are pretty common. So I need you to tell me if you can distinguish, and we're looking at how well your brain can perceive the stimulus. This is gonna feel a little bit wet, okay?
Mm. The circle. Two. Oh, there's more. A square. An A. I don't know.
Okay.
A V. I don't know.
Okay.
A C. A V.
All right. That looks good. I'm going to go ahead and wipe that. Okay, perfect. Okay, I'm going to go ahead and remove the ponytail. So we're going to take a look at your scalp. Looking for any lice infestation, also eczema, and any skin disorders that we can definitely treat very easily in the office. So I'm not noticing any signs of parasites. We can go ahead and just take a look at the skin. Okay, I'm gonna have you lay down, and I think that's when I'll be able to take a look better at your scalp. I am noticing a little bit of redness. Any increased itchiness or dryness of the scalp that you've noticed?
A little bit, yeah.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold. Cold.
And did that change in intensity?
No.
Stay the same, okay. Now go ahead and tell me if you feel this sharp or dull.
Sharp.
And do you feel this sharp all the way?
Yes.
Did that change in intensity?
No.
I'm going to take a sample and we're going to send this to the lab. Since I'm noticing that redness, I just want to make sure that there's nothing concerning. And if there is, we're just going to get a proper treatment and know exactly how to heal it. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
And does this feel cold or warm?
Cold. Warm.
And do you feel this sharp all the way?
Yes.
What about now?
No.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
Now.
Good.
Now. Now. Now.
Okay. Going to palpate your ears first, and then we're going to check for any auditory deficiency. We're checking for mastoiditis, which is the bone right behind your ear. Sometimes the only sign of that type of infection is just some tenderness that is behind on the bone, and there doesn't seem to be any inflammation. Going to slowly palpate your ears. I'm not feeling any nodules, which is good, on both left and right. Go ahead and tell me with which ear you hear the sound.
Right. Left. Both.
Okay. Now go ahead and tell me when you don't hear the sound anymore.
Now. Now.
And tell me which position here is louder, position A or B. So this is position A, and this is B.
B.
And this is position A and B.
A.
Going to slowly palpate your nose and then moving to the sinuses. I'm not feeling any swelling. And there's another set of sinuses right in between the eyebrows, a little bit above. Hairline looks intact. I'm not seeing any signs of alopecia. Checking lymph node placement to see if there is any signs of inflammation. We're looking for any nodules. So we're palpating preauricular lymph nodes and postauricular. Also submental right under the chin. I'm going to check for any TMJ disorders. So I'm going to have you slowly open your mouth as wide as you can and slowly close it as soft as you can. I'm not feeling any clicks there. Normal hair distribution of the eyebrows. Eyelashes also look normal in size. The eyes are symmetric. Not feeling any swelling around it. Good. We're going to go ahead and check your sense of smell. So that's your olfactory nerve. I have here an essential oil smell. Go ahead and try to take a deep breath into your nose and out through your mouth. And see if you can identify that smell.
I don't know what that is.
Okay. I have here a few more so we can definitely make sure that the test is accurate. Go ahead and see if you can identify that.
Mint.
Okay, that was close. I do have one more. What about this one?
I don't know what that is.
Let's go ahead and check your taste. I'm going to place a drop of this essence on your tongue. I'm gonna have you identify it, okay?
Mm-hmm.
Go ahead and open your mouth. Good.
I don't know what that is.
Okay. We're definitely gonna have to do more tests and see exactly why that is happening. I'm going to go ahead and check your abdomen and skin now, okay?
Mm-hmm.
I'm going to go ahead and listen to your heart. Okay, I can hear only S1 and S2, no S3, no S4. We're listening for any murmurs now. I'm gonna have you take a deep breath in and hold it for 3-4 seconds, okay? And hold it. And breathe out. Okay. Everything looks good. I'm going to listen to your lungs now. I'm going to have you take a deep breath in and exhale. And again, breathe in and exhale. Good. Now I'm going to listen to the sides as well. Breathe in and breathe out. And again, breathe in and breathe out. Okay. I'm going to check the skin on your arms, okay? I'm definitely noticing the scar here on the left elbow. I'm going to lift your arm up a little bit. Okay. I'm going to check the skin. We're looking for any raised bumps. Capillary refill is within 2 seconds. splinter hemorrhages. So there's no palmar erythema. No signs of vitamin B deficiencies. Just going to go ahead and check for any raised bumps. There's one right here on the right elbow. But it looks normal in size and I'm not seeing any abnormal discoloration. I'm just going to write that in your file and take a look at it in a few months. Okay, we're going to take a picture of this and save it in your file. Okay. Now we're gonna go ahead and check your legs. Just going to slowly palpate. Let me know if you feel any kind of pain. We're looking for asymmetry and changes in temperature. Checking beatal pulses. Good peripheral circulation. Capillary refill is within 2 seconds. Normal temperature. And I'm not seeing any edema. Okay. Again, we're checking to see if there's any skin moles, lesions that would require attention. There is one right here on your foot. We're going to go ahead and take a picture of that as well. Keep it in your file. Just gonna watch it and see. Going to look in between your toes to see if there is any eczema. I'm going to do Babinski reflex here. Just relax. Good. And one more time on the left side. Good. I'm just going to have you push your pads towards you, okay? Towards you. Towards you. Like so, push your legs. Pull your legs towards you. Perfect. And now push with the pads away from you. Both of them. Okay, good. I'm going to slide my hands under your heels and go ahead and push. Okay, good. Now I'm going to try to push your legs down. I'm going to start with the right leg and don't let me do that, okay? Okay. And I'll try to that leg. It's perfect. Good. Go ahead and listen to your belly. It's going to feel a little bit cold. You can Definitely just breathe normal.
Going to percuss.
And slowly I'm going to palpate. Let me know if you feel any kind of pain. Were you feeling some pain here?
No.
Okay. Going to go ahead and have you sit back on the table and we'll talk about the results. Alright, I'm just going to go ahead and take off these gloves. And I took some pictures of a few spots that I thought they were a little bit concerning. Now we have them in your file and we're just going to compare them with 6 months from now. I'm gonna have you come back. Okay, so it's May, kind of like December.
Mm-hmm.
Okay. Perfect. Do you have any questions for me?
No.
All right. Thank you so much for coming in, and I'll see you soon.
Thank you.
It's gone. I just feel pressure. I can barely smell it. A little bit sharp. Sharp.
In.
Right. Dull. Sure.
Hi, Hannah.
Hi, Dr. Matt.
How are you today?
I'm good, thank you.
Thanks for coming in. So, you've been experiencing some pain or discomfort?
Yeah, so I was in an accident the other day where I was skiing and just sort of face planted and hit my chin and my jaw. And it's
Okay.
been bothering me since then.
Okay. Did you hurt your head or just the...
No, I went forward, so it didn't impact my head as far as I'm aware, but I'm sure I got jostled up.
Okay. Since it's been a while, I'm going to go ahead and just get some medical history. Can you verify your last name for me, please?
Is it Chili?
Perfect. And your date of birth?
August 4th, 1990.
Okay. Do you have any allergies to medications?
No.
All right. And how long ago did this accident happen?
It was 2 weekends ago, so about 10 days.
Okay. On a scale of 0 to 10, how bad is your pain right now?
Currently, it's at about a 3.
And how would you describe it? Is it achy, throbbing?
Throbbing. Yeah. And a little tingly, too. prickly.
Okay. Are you taking any medications on a daily basis?
I've been taking just some ibuprofen to counteract the discomfort, but nothing on a regular basis, no.
Okay. Ibuprofen. Okay, for medical history, do you have any family history of neurological disorders?
No,
Okay, seizure disorders?
no,
And you said you didn't injure your head. Did you lose consciousness?
no, I did not.
All right, can you please verify today's date for me?
Today is December 3rd, 2024.
Good. And who is the current president?
Biden.
Okay. All right. We're going to go ahead and take your vital signs. We're going to start with blood pressure and temperature. I want to make sure that there's no underlying disorders here. I'm just going to sanitize my hands. This will go under your tongue. Okay, very good. I'm gonna have you hold it. And then we'll put this on your index finger. This measures your oxygen and your heart rate. Okay, let's go ahead and check that. 97.7 Fahrenheit. Did you have anything to drink before coming in here? Okay. Heart rate 83, oxygenation 95%. Okay. I'm going to measure your blood pressure. Is it okay if we use your left arm?
Yes.
Okay. Yes, very good. Thank you. Okay, I'm gonna have you relax. I'm just gonna have to clip this here. Okay, so kind of like a squeezing sensation. Okay. Blood pressure is 135/6. Is it okay if I listen to your heart and your lungs? Alright. I'm gonna put this on the right side of your chest first. Take a deep breath in and breathe out. And again, breathe in, breathe out. And again, take a deep breath in and exhale. Good. You can breathe normal now. I'm just going to listen to your heart. I can hear only S1 and S2, no S3, no S4. Okay, we're going to listen with the bell. Go ahead and take a deep breath in and hold it for 3 seconds. 1, 2, 3. Breathe out. Very good. Okay. I'm going to listen to your neck and your jaw. I'm feeling a little bit of pulsation coming from the jawline, moving down to the neck. Go ahead and take a deep breath and then hold it for 1, 2, 3. Breathe out. Okay, no blurry there. I'm going to check your other side now. Okay, go ahead and breathe in again and hold it in for 1, 2, 3. Breathe out. Okay, no blurry there either. Okay, I'm going to have you keep your eyes closed. I'm going to check your hearing. I want to make sure that your nerves that help with hearing are not damaged. Since the accident was so close to the neck region, I want to make sure that everything is intact. Go ahead and tell me when you don't feel this vibration anymore.
It's gone. It's gone. Gone. Gone.
Okay, slight delay on the right side. Go ahead and tell me which position here is louder, 1 or 2. This is 1, and this is 2.
2.
This is 1, and this is 2.
Slightly 2, but they're kind of similar.
Go ahead and tell me if you feel this the same on both sides, left and right.
I just feel pressure.
Tell me when you don't feel this vibration anymore.
Gone.
Same thing, tell me when it stops.
Gone.
Slight delay on the right side. Okay, I'm gonna have you keep your eyes closed. I'm going to give you something, it's a piece of paper. I'm gonna have you taste it and try to describe the taste and let me know what that feels like. Go ahead and open and close. And you can.
Bitter.
Okay. To check the inside of your mouth, you can go ahead and open. I'm noticing any lesions. Tongue is a little bit more elevated on the right side. Can you go ahead and move your tongue up and down for me? I'm looking to see if there is any lesions. Right and left. Okay, slight abnormal movement to the right side. Go ahead and stick your tongue towards your inside your cheek. Okay, and the other side. Okay, definitely right side has decreased
a range of motion. Can you go ahead and give me a big smile and frown? Can you try and frown with your eyebrows? Okay, good. Puff your cheeks for me. And I'm gonna need you to keep them puffed. Definitely on the right side is very flaccid. I'm not noticing any movement here. Okay, go ahead and relax. Very nice there. Okay. Next, we're going to check your olfactory nerve. Have you noticed any abnormal smells? A smell that is not there?
No, I haven't.
Okay. I'm going to first palpate your nose. Let me know if you feel any kind of pain. Okay. Go ahead and breathe in, breathe out. Check in patency. And breathe in, breathe out. Okay, slight diminished on the left side. I have here a few smells. What I'm going to do is I'm going to have you close your eyes and try to describe the smell first and then see if you can identify it. This is going to go mostly on the left side of your nose.
It smells kind of fruity, maybe banana or something.
Okay. Let's go and try something different. These are very strong scents, so I'm expecting you to be able to identify the smell very easily.
It's very sweet smelling, but I don't know exactly what it is.
Okay. I'm going to bring this one very close to your nose. Let me know if it bothers you or if you can barely smell it.
I can barely smell it.
Okay. And can you identify what it smells like?
No.
Okay. Let's try one more.
Maybe honey?
Okay, this was definitely coffee. And I do have some concerns. I'm going to have you change into a gown and we're going to do a more in-depth examination. Okay, Hannah, it's very important that we determine if there is any physical change in the joints around your jaw. Since this is where the accident was, I might expect for you to feel a little bit of soreness, but I don't want there's soreness. Okay. Is it on both sides or left or right?
More on the right side.
More on the right side. Okay. Let me know when you feel the most pain. From a scale of 0 to 3, let me know where you feel like a 3.
3 right there on the right side, 2 on the left.
Okay.
And then there as well.
Okay.
Oh, right there. So 3, yeah.
Okay.
That doesn't feel too bad.
Okay. So it's mainly located in the bone tissue, but this is for sure.
Well, actually, that does fit that right there.
Right here.
Mm-hmm.
Okay. So we're getting very close to the TMJ. TMJ
is supported by 3 ramifications of 3 nerves. So we have the one that goes towards your eyes, and then we have nose and mouth, and the other one moves down to the salivary glands. I'm going to start with a gentle palpation. See if there is any lymph node enlargement. Take a look at your face and sinuses. So first we're palpating the forehead. This is where we have the first pair of sinus. See if there is any tenderness, fluid buildup, blockage. To palpate now right under your eyes. This is we have a second pair of sinuses that sometimes can be disrupted. Okay. Palpating the periorbital area to see if there is any fluid buildup. Okay, I'm going to check some muscle movement. This is going to feel kind of like a scraping sensation. I'm just gently applying pressure. See if there is any inflammation. Okay, so let's check facial sensitivity. Go ahead and tell me if this feels like this.
Yes.
And if this feels like this.
Yes. No, that felt more on the left side than the right side.
Okay. Go ahead and tell me if this feels dull or sharp.
Dull. It's even softer. A little bit sharp. Sharp. Dull. Sharp.
Alright. Can you just show me what they're supposed to feel like, sharp or dull?
Sure. So this is what dull feels like, and this is what sharp feels like.
Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Go ahead and tell me if this feels same as this.
No, feels different.
And does this feel the same as this?
No, feels sharper on the left.
Go ahead and tell me if this feels cold or warm.
Cold. Can you do it again? It's sort of neutral.
Does this feel the same as this?
Yeah, I think so.
And does this feel the same as this?
No, the second one's colder.
Okay. Does this feel warm or cold to you?
Warm.
Warm or cold?
Warm.
And does this feel the same as this?
No.
Does this feel the same as this?
No.
Okay. Can you feel this warm or cold?
Warm.
What about now?
Cold. Warm. Warm. Cold. Cold.
Go ahead and tell me if you feel any changes in temperature.
It's a little warmer by the chin.
And do you feel any changes in temperature here?
It gets a little colder as you go this way.
Okay. Okay. This is just a makeup mist set, but I'm gonna use it to determine if there is any abnormality in the sensation. I'm gonna touch you with a wet surface. This is what wet is gonna feel like. Can you feel that wet or dry?
It's wet.
Okay. Does that feel the same as this?
It just feels like a little less pressure, but I can feel the wetness.
Okay. Does this feel wet or dry?
I think dry.
What about now?
Wet.
And now?
Wet. I think dry. Wet. I'm not sure. Wet. Wet. Dry. Dry. Wet. Wet. Wet.
Okay. Let's take a look at your scalp and head. Just gonna fix your hair here. Go ahead and tell me if you feel this 2, 1, or 3 taps.
2, 1, 3, 3, 1, 4.
Sorry about that.
2.
Okay. Just going to palpate the hairline. I'm going to touch you with two surfaces. One is going to feel dull. This is what dull is going to feel like. And the other one is going to feel sharp. Okay, go ahead and tell me if you feel this sharp or dull.
I think sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Dull.
Okay, I'm going to use this comb to find the midline. Go ahead and tell me if you feel this equally on both sides.
Yes.
Okay, so that's going to be left. Go ahead and tell me if you feel the same as the right.
Yes. Same. Same.
Okay. Does this feel sharp or dull?
Sharp.
Okay. Does this feel sharp all the way?
Yes.
Okay. Do you feel this on the left or right of your side?
Slightly more on my left, but it's pretty middle. Now slightly more on the right. Right. Left. Left. Right.
Okay. And does this feel cold or warm?
Cold. Warm. Cold.
Okay. What about now? Does this feel cold or warm?
Warm. Warm. Warm.
Okay. Do you feel this on the left or right of your part?
Left. Right.
Does this feel wet or dry?
Wet. Wet. Couldn't feel.
Okay. Does this feel sharp or dull?
Sharp. Does this feel sharp all the way?
Yes.
And does this feel cold or warm?
Cold. Yeah, cold. Cold.
Does this feel warmer than the last object or colder?
Warmer.
And does this feel warmer or colder than the last one?
I couldn't tell there. Colder. Colder.
We're gonna go ahead and check your back as well. I want to make sure that there is no damage to the spinal cord, and we're gonna figure out why the sensation really stops towards the top of the head. Yeah, I'm afraid it might be coming from the spinal cord. We're gonna run some more tests. Okay, and I'm gonna go ahead and palpate your back, looking for any spine damage, bulging discs, any signs of disc herniations. Sometimes we can have jaw and neck pain that's coming from the spinal cord. I'm going to listen to your lungs. Hearing a little bit of decreased breath sounds on the right sides. We want to make sure that there is no collapsed lung from the accident. Any rib fractures. Okay, gonna feel a tapping sensation. I'm not noticing any signs of spinal cord fractures. We're going to do a sensation assessment. This is going to feel a little bit cold. I'm applying a gel that will help the skin to register the touch. I'm going to use a cotton swab. Go ahead and tell me what letter I'm drawing.
Can you do it one more time? Oh.
Okay. We're going to increase the difficulty here.
N. H. R. P.
Okay. Let's go ahead and go a little bit higher on the neckline. Go ahead and tell me what shape I'm drawing.
Circle.
What about now?
Square. Triangle.
Okay, so I think we can go ahead and move a little bit down. Go ahead and tell me what number I'm drawing.
3. 8. 5. 7. I think it's 5. Maybe
Okay.
a 2.
No worries. Let's go ahead and wipe that. Go ahead and tell me if you feel this on the left or right side.
Left. Right. Right. Left. Left. Right. Right. Felt pretty middle. Felt pretty middle.
Oh, good. That's perfect. Okay, we're gonna look for any abnormal pulsations on the spine. I'm going to touch you with two textures. One is going to feel sharp, the other one is going to be dull. Go ahead and tell me if this feels sharp or dull to you.
Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Go ahead and tell me if this feels sharp all the way down.
Yes. Yes, sharp all the way.
Okay. And does this feel dull all the way down? Any changes there?
No.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
It's gone. 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 Gone.
Does this feel cold or warm?
Cold.
What about now?
Warm.
Does this feel cold all the way? And now? Does this feel warm or cold? Does this feel the same as this?
Mm-hmm.
And this, does it feel the same as this?
Yeah.
Do they feel the same?
No.
What about now?
No. Not the same. Does this feel wet or dry? Dry. Dry. Wet. 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 Dry.
Does this feel dry all the way?
No.
What about now?
No. No, it feels wet halfway down.
Okay. That looks good. Okay, and it does look like there's no spinal cord injury. We're gonna go ahead and order an MRI of the neck and head. I want to make sure that there is no internal bleeding, any damage to the nerve tissue that goes up to the scalp. Since there is a little bit of abnormal response on top of the head, we're gonna go ahead and do a CT scan as well so that we don't miss any aneurysms or anything that could be indicating an emergent situation. Thank you for coming in.
Yeah.